right? These are all basically wherever you place this device on the human body, we're seeing a positive biological effect. And that's awesome. That makes me excited. It's from improved mitochondrial function, increased angiogenesis, neovascularization. We had a whole class on left ventricular ejection fraction and what Dr. Johannes Holfeld, the cardiac surgeon out of Innsbruck, Austria, is doing, and 67 bypass surgeries, recruitment of the innate immune receptor, toll-like receptor 3, which is really key in modulation of healing and really how you affect inflammation. We see it in improved sexual men and women's health, improved range of motion. I always say it's like the WD-40 for internal joints, for tired and arthritic joints, decreases pain, improves the Austrian workers' comp system has, over the last 11 years, has estimated they saved 70 million euros using our technology in 13 of their trauma centers. It has wound healing. We actually, our doctors, our med doctors at our clinic actually get paid for wounds and diabetic ulcers. Improved exosome circulation, improved blood flow, decrease inflammation and swelling, and again, class 2 clearance of activation of connective tissue. What is connective tissue, Doc?
Fascia, ligaments, bone, periosteum. There's a big.
That's right. Oh, this is under electron microscope. This is the mitochondrial before, as you can see that, and then it's in an anaerobic state and it's only producing ADP, adenine diphosphate. Now look at after. This is 10 minutes after utilizing soft wave on the mitochondrial. Those are the powerhouse of the cell, but there are so much more. They're in every cell in your body, except your red blood cells. They make up, if you took them all out, they make up 10 to 15% of your body weight, and they are part of your immune system as well. So we are registered 510 clear device to help reduce pain and improve blood supply. We were also class 2 technology for treatment of acute second-degree burns, treatment of chronic diabetic foot ulcers, and activation of connective tissue. This is from the US, the FDA, and, oh, sorry, I don't know what I just did there. Can you still see it?
Yeah.
And, there we go. And the OrthoGold 100 is intended for the activation of connective tissue. This is why I'm so excited about this. What is connective tissue? Just like you said, it's the blood, it's the bone, it's the adipose tissue, it's the cartilage, it's the fabric of life, it's the matrix of everything, right? And you can see that under a microscope, what the different types of dense connective tissue, adipose tissue, areolar tissue, compact bone, and blood. So it's the cartilage between the shock absorber between those joints and bones. It is the blood. It's the plasma. It's all of this. It's the cartilage, the nervous system, the bones, the epithelial. I could keep going, right? In the elbow, it's the cartilage, the bone, the blood, the fibrous tissue, the subcutaneous fat pad underneath this. It's everything. Nervous tissue. So we can just keep digging down. It's the endothelial of the arteries that in capillaries. It's part of your spinal cord. It's the interlining of your stomach. I believe with our more is more protocol, with the new OrthoGold 350, you're going to see us working more on organs. And Tom Liu, he's got a patent for organ regeneration. That's even tendons. See that? Tendons. So you can see effectiveness and versatility, really healing from within. And this is a non-healing ulcer to the left that wasn't healing for months. And after 4 treatments, over a 6-week period, it healed. He'd already had 2 of his outer digits amputated, and they were looking at a below the knee amputation. The one on the right is from our friend, Dr. John Mullins at Piedmont Hospital. It was a non-healing talus fracture for months. He did 4 treatments over a 3-week period, and this was taken 5 weeks later. So you see it on the right, healing that MRI. Okay. So again, this is the OrthoGold is a acoustic pressure treatment for chronic foot wounds and ulcers. It is a class 2 clearance for superficial burns, and it will be, it is, OG 100 is the standard of care for burns, and that's where we're looking at. You see all the different applications. We know it works in orthopedics, physiotherapy, rehabilitation, any type of itis, tendinopathies, right? Any neurological ones, that's your specialty. But anything with like arthritis, inflammation, it's working. And we have over 48 patents. And this one that I just popped up there, that's for neural elongation and promotion of nerve regeneration and nerve growth. How many companies have that? Not many. Not many, my friend. We're trusted. We're in some of the top teaching hospitals and universities, as well as Cleveland Clinic, Mayo Clinic, 15 different professional sporting teams. It's effective. What's your average time you're in there with a patient doing the treatment, Doc?
5 to 7 minutes, probably.
That's clean, putting the gel on, the supersonic gel, doing the treatment for 4 to 5 minutes, cleaning them up.
Mm-hmm.
It's effective. It's proven. It's very user friendly. We know within minutes if these patients are even candidates. That's what I love, right? Because if you run it over their chief complaints and we can't find pain, they're not candidates. And this is one of my favorite patients. She would come down from Philadelphia. On the left is a cyanotic foot prior to soft wave. And on the right is a 3-minute treatment. That's on my YouTube page, Dr. Matt Duro, the actual treatment. So we're almost finished. Thank you, Doc. We went through a lot of material.